This research was part of a larger study known as the Canadian Alliance for Healthy Hearts and Minds, and it's a study that's aimed at trying to understand early causes of dementia and stroke. We had auditors go into over 2,000 communities across Canada in all 10 provinces. They used a standardized form to collect information on community demographics, access to public transit, the food environment, that's restaurants, groceries, advertising for alcohol, tobacco, and what we call junk and healthy foods, and also the price of groceries, alcohol, and cigarettes. We found that there were some important differences between provinces and between urban and rural settings. We found, for example, that the prices of food and groceries were generally higher in rural areas, and also rural areas had much more variability with respect to fruit and vegetable availability across seasons. We also found that advertising for junk food, sweetened beverages was actually more common than products like tobacco. If you live in a city or an urban environment, you're probably more likely to have access to healthy foods, or at least know whether or not foods claim to be healthy when you're sitting down at a restaurant. So it's easier to find some of that information in an urban rather than a rural setting. We think that this study has the potential to have unique impact because we've taken some of the data that we collected and we've put it online in a publicly available map. And we think that this forum will allow both public health professionals and urban or city planners to work together to address the built environment, making our cities and our towns healthier and safer for everyone.